Imagine your lungs as branches of a tree, constantly breathing in life, giving air. Now, picture those branches suddenly constricting, making it hard to breathe. This is asthma, a chronic lung disease that affects millions worldwide. In this video, we'll explore what asthma is, what causes it, how it affects your body, and what can be done to manage and even prevent it. Asthma doesn't have one single cause, but rather a complex interplay of genetic and environmental factors. Think of it as a perfect storm. Some people are genetically predisposed, meaning they inherit a greater likelihood of developing asthma. This predisposition can be triggered by environmental factors such as exposure to allergens like pollen, dust mites, mold, and pet dander. Irritants like air pollution, smoke, chemical fumes, and even strong perfumes can also trigger asthma. Respiratory infections, such as colds or the flu, can lead to airway inflammation, making asthma symptoms worse, and in some cases, even exercise or cold air can provoke an asthma attack. So, what exactly happens inside your lungs when you have asthma? The airways, or bronchial tubes, become inflamed and narrowed. This inflammation causes the lining of the airways to swell. The muscles around the airways tighten, constricting them further. And finally, the airways produce excess mucus, a thick, sticky substance that clogs the passageways. All of this makes it difficult for air to move in and out of your lungs, leading to the characteristic symptoms of asthma. Asthma is a widespread condition affecting people of all ages, races, and socioeconomic backgrounds. Globally, it's estimated that hundreds of millions of people have asthma. It's one of the most common chronic diseases in children, often starting in early childhood. While asthma can occur at any age, it's more prevalent in developed countries and in urban areas, possibly due to higher levels of air pollution and allergen exposure. Understanding the epidemiology of asthma helps us better allocate resources and develop targeted prevention strategies. The signs and symptoms of asthma can vary from person to person, and even from day to day. The most common symptoms include wheezing, a whistling sound when you breathe, coughing, particularly at night or early in the morning, shortness of breath, a feeling of tightness or pressure in your chest. These symptoms can range from mild and occasional to severe and life-threatening. An asthma attack is a sudden worsening of symptoms, and it's crucial to seek medical attention if symptoms are severe or don't improve with medication. Diagnosing asthma typically involves a combination of medical history, physical exam, and lung function tests. Your doctor will ask about your symptoms, triggers, and family history of asthma or allergies. During the physical exam, they'll listen to your lungs with a stethoscope to check for wheezing. The most common lung function test is spirometry, which measures how much air you can inhale and exhale, and how quickly you can exhale it. Another test, called a bronchodilator test, measures how much your lung function improves after taking medication to open your airways. These tests help confirm the diagnosis of asthma and assess its severity. Asthma can be classified based on its severity and how frequently symptoms occur. Intermittent asthma is characterized by infrequent symptoms, typically occurring less than twice a week. Mild persistent asthma involves symptoms more than twice a week, but not daily. Moderate persistent asthma involves daily symptoms that may limit some activities. Severe persistent asthma involves continuous symptoms that severely limit daily activities. Understanding the classification of your asthma helps your doctor tailor the most effective treatment plan for you. While there's no cure for asthma, it can be effectively managed with medication and lifestyle changes. The goal of treatment is to control symptoms, prevent asthma attacks, and improve quality of life. Medications for asthma fall into two main categories: quick relief medications and long-term control medications. Quick relief medications, also known as rescue inhalers, provide immediate relief during an asthma attack by relaxing the muscles around the airways. Long-term control medications, such as inhaled corticosteroids, help reduce inflammation and prevent asthma symptoms from occurring in the first place. In addition to medication, it's important to identify and avoid your asthma triggers and to follow your doctor's recommendations for managing your condition. Preventing asthma is not always possible, especially if you have a genetic predisposition. However, there are steps you can take to reduce your risk of developing asthma or to prevent asthma attacks. Avoiding known allergens and irritants is crucial. This might involve using air purifiers, regularly cleaning your home to reduce dust mites, and avoiding smoke and strong perfumes. Getting vaccinated against the flu and pneumonia can help prevent respiratory infections that can trigger asthma. For children, breastfeeding and avoiding exposure to tobacco smoke can reduce the risk of developing asthma. The prognosis for people with asthma is generally good, especially with proper diagnosis and management. Most people with asthma can live normal, active lives with few or no limitations. Recent research is focused on developing new and more effective treatments for asthma, including biologic therapies that target specific inflammatory pathways in the lungs. Scientists are also exploring ways to identify individuals at high risk of developing asthma and to intervene early to prevent the disease from developing. With ongoing research and advancements in treatment, the future looks bright for people with asthma.